Hey everybody, in this video I'm going to help you decide whether or not to choose a chiropractor or a physiotherapist if you are struggling with neck or back pain and you've decided it's time that you seek some professional help. My name is Dr. Paul Groulx. I'm a chiropractor in Ottawa right here on Merivale Rd. And full disclosure, like I said, I'm a chiropractor, and you might be thinking, well, I'm going to be really biased in who you should pick. Now, a few years ago, I would have said that that's absolutely true, but in 2011, I had a near-fatal illness that absolutely devastated my body. The recovery was very long, and I depended heavily, this is one of the good things that came of this, I depended heavily on other health professions to help rehabilitate me and get me back to work and back into my life. And so one of the professions that I learned to appreciate in that time, believe it or not, is physiotherapy. Now, I know historically chiropractors and physiotherapists do this, and maybe that's still true in a lot of cases, but I can tell you that the physiotherapy office down the street from me, I am one of their top referring people. I send a ton of people to physiotherapists week after week, and there's a reason that I do that. There are some things that I really believe that chiropractic is way better than physiotherapy, but there are some things that I really believe physiotherapists are much better suited than we are. I'm going to start with, I have my notes here, I'm going to start with where do I feel that physiotherapy is better than chiropractors? So number one, very simply, extremities. So if you've been playing tennis and you tweak your shoulder or your elbow or your knee and you've injured yourself in some kind of a sport and it's an extremity, like I said, like a knee, shoulder, elbow, physiotherapy by far, in my opinion, there's some of my colleagues that won't agree with me on this, but physiotherapy I think is much better suited than chiropractors for that. Also, if you've just had surgery, you need some rehabilitation. Physio, great, much better than I would be in my practice. If you've just had a car accident, and especially in the early stages, in the late stages, in the post-acute phase, I have a different opinion, but in the early stages of a car accident, when you're really, really acute, you're going through insurance, and you need that inflammation taken down in your joints and your neck, that whiplash, I would recommend physiotherapy over chiropractic for sure. Also, if you've had a work-related injury, you're on WSIB, and ultimately what you need is some professional rehab, but really a lot of work hardening. That's what they call that in WSIB language or in rehab language. Physiotherapy is going to do a better job than chiropractic. And lastly, and I don't want to understate this, sometimes people really value the length of a visit. So for example, let's say physiotherapy in Ottawa ranges anywhere between $75 and $125 for a visit. And you'll feel ripped off unless the physiotherapist spends at least, say, 25 or 45 minutes with you. Physiotherapy, in general, are going to be much longer appointments than chiropractic appointments. On the flip side, your adjustment visits can be very brief. I've got your x-rays up on screen. I've done the analysis, a really involved first day assessment. Your visit, you come in, I check in, you check in with me, I adjust you, you're out, and you're on with your day. You're not spending, 30, 45 minutes. The visits can actually be really brief. That's an upside, depending on what you value. In general terms, if your problem is truly spinal related versus muscular, then chiropractic is going to be your best choice. And here's why, and here's how you differentiate between the two. When it comes to the actual spine, I believe chiropractors are going to give you superior care over physiotherapy. But how can you tell the difference whether something is muscular or whether or not it is spine related? And this can get tricky. Sometimes you can get pain, let's say not in the shoulder, but right up in here. You'll call this your shoulder, but this muscle that goes from your shoulder up into your neck. I'm not pointing to the spine here. I'm pointing to the muscles that are attached to the spine. If that tension, that pain has been present for more than, say, a week, the pain is in the muscle. It feels muscular. But when it's been there for more than a week, the root cause in almost every circumstance is going to be in the spine. And when the problem is in the spine, I will say that a chiropractor is going to do a better job than a physiotherapist. The same thing across the lower back. Sometimes people will have broad low back pain right across their lower back, and it feels muscular. Well, it may be if it's been muscular, it comes and it goes, and it comes and it goes, and it comes and it goes, and it's always muscle, and it's always short-lived. Then you have a muscular problem. If, however, you've got this low-grade nagging tension or even an acute low back pain that's been going on for more than a week, in my experience, very, very, very likely that the actual root of the problem is not muscular at all, that it's actually in your spine. And as a result of that, chiropractic will likely be your best choice. Also, things like headaches, sciatica, carpal tunnel syndrome, these are all directly nerve-related or nervous system-related disorders that when compared to physiotherapy, I'm going to say that chiropractic is going to do the better job. Here's why. When we're adjusting the spine, not only are we working to relieve the pressure in the joints of the spine, we're also taking the pressure off the nerve tissue. The spine, it holds your spinal cord, and then there are these nerves that emerge from every level to go to different body parts, including down your arm, down your leg. It can also create headaches. And so those types of nerve-related symptoms, if you had to choose between chiropractic and physiotherapy, chiropractic is going to be your better choice. All right, so there's a lot more information, how to choose chiropractor, how to choose physiotherapist, East versus Western acupuncture, osteopathy, orthotherapy, as well as some resources, some retail products that I think are good, as well as things that I don't recommend for people who are seeking pain relief. I'm Dr. Paul Groulx. We'll talk soon.